In tonight's show, we'll speak with Irma Cota, President and CEO of North County Health Services, to discuss the impact that the Affordable Care Act has had on health services over the past 3 years or so, and what the future of the Republican control in Washington may portend. Our next guest will be Thomas Arnold, an experienced journalist here in North County who will discuss results of the recent North County elections. Our third guest will be Nathan Mader with the London Group, who will be representing the perspective of real estate interests on the recent land use conflicts in San Diego County. Our final guest on tonight's show will be Sandra Farrell, representing the rural community residents in San Diego on the same topic of growth. But first, we're here with Irma Cota from North County Health Services. Welcome back to our show, Irma.
Thank you.
Now that the Republicans have taken control in Washington and can presumably, if they so choose, fulfill their stated desire to repeal Obamacare, can you tell us a little bit about how this uncertainty is affecting us here in North County?
Yes, we are actually waiting to hear the details because Congress and the President, they do have an opportunity to take what has been available in the last 3 years to cover the uninsured and to reduce the number of uninsured in the country. They have an opportunity to take the current product and make it better, because there are opportunities to improve. There are geographic areas that were never served by this program. Only 31 states adopted the healthcare exchanges and adopted the expansion of the Medicaid program. So there has been uneven coverage throughout the country. So there are reasons why some areas of the country are unhappy because they didn't feel the impact of the Accountable Care Act or the Affordable Act, as some people call it. Here in California, about 3.5 million people did take advantage of the Medi-Cal expansion, as well as another 2 million who took advantage of the Cover California. By extension, those of us in community health centers that provide health services to the Medi-Cal as a preferred provider for Medi-Cal clients because of the dearth of private sector taking Medi-Cal for primary care. So we are that safety net. So for us in the community health center world, not just in California, but throughout the country, it reduced by a very large percentage the number of uninsured, primarily adults, because this coverage was primarily intended for adults. But it also, of course, provided a number of other benefits that many people are benefiting from it, such as the coverage of the young adults with their parents' insurance who are still dependent on the parents.
Coverage to 26.
Yes, it also did away from the pharmaceutical donut hole for Medicare. It also protected individuals who had chronic conditions and who had pre-existing conditions, protected them from health insurance not wanting it to cover. So the benefits of this act is beyond the coverage of millions of people, but 51 million individuals who have chronic conditions and pre-existing conditions now can breathe a little easier and not worry about medical bankruptcy. So when you do the ripple effects of who's touched in this country, it's more than just the 23 million that are officially covered under this act. So we have as I said, the opportunity to see if we can best it, and improve on it, rather than just think about cutting benefits or cutting individuals that are covered by this.
What kind of improvements do you think your clients would want to see? What are they looking for in the reform?
I think that one of the improvements, as I said, is maybe more states participating in the Medicaid expansion. In the states where there's less coverage because the population is low and there's very little participation of health insurances, perhaps there can be some enticement for more insurances to enter those markets so that states that are not currently represented and the population there can benefit from some of the services.
Wasn't that one of the ideas, that instead of making the exchanges state-specific, to make the exchanges across the country?
For health insurance, the portability of health insurance, that would be one of the benefits,
But
improvements.
The thing is, North County Health Services is part of a number of community clinics, right,
Yes.
that help people who are, in many cases, on Medi-Cal.
Yes.
And if Medi-Cal is a significant portion, that's why you've expanded so fast. Let's
That's
face
correct.
it, you've built new clinics since the Affordable Care Act came into place.
Yes.
So if it's now changed, is there a threat that you may lose some of the insurance that comes through Medi-Cal that has supported your services?
Yes, we definitely have a threat. Those individuals, so some of our patients prior to this act were on sliding scale. We gain an initial 7,000, so the uninsured became insured, and then we gain another 7,000 new patients. And it was not just North County Health Services, but Vista Community Health Center, Neighborhood Health, and there's a couple other clinics in the area. Together, this expansion, we probably took on 70,000 additional insured clients.
All
So-
of the clinics in
that
total?
in North County, much more so throughout the county. So suddenly, if this totally goes away, then we will have those 70,000 people that were insured in this new program uninsured. The new clients are now used to us. Maybe they found us, maybe they didn't know about us or had not experienced us before, and now they've experienced us for 3 years. We demystified whatever negative attitudes may have been there about community clinics. So that's a win for us. We've gained these clients, and as long as there are some federal subsidies that we get for sliding scale, then these individuals will also continue to get their care with us, but under the sliding scale. However, because it's their dime, and they also have to make decisions about childcare, housing, food, and transportation, oftentimes the health screenings go ignored. The initial symptoms for healthcare get ignored. They wait too long and they end up in the emergency room or they end up hospitalized. So those are the potential negative effects to our society and our community. Those extra costs will end up in hospitals. And the hospitals in our region are already trying to and struggling to make it, financially. So once you then add this additional added burden, it'll become a difficult situation for us in the community.
The conversation out of Washington is a little muddled. You hear some politicians saying, "I want complete repeal. I want it like now."
Yes.
You hear some news reports of some Republicans saying, "Well, we need to do this slowly and carefully."
Right.
I know that I think the president has said, "I want people to be insured."
Right.
Do you have any sense? Is there any clarity coming about what's likely to happen?
Well, there's about 3 different proposals that were already available prior to President Trump taking office. I like what I hear, that he wants people insured. That is very encouraging. It's going to incumbent on the Republican Party to come up with the replace portion of it. They could provide insurance, but they can provide limited benefits. So that could be one of the results of you're still insured, but those benefits are fewer. One of the expanded benefits was that you suddenly had parity with mental health services. Mm-hmm. That could potentially, that could be something that they can decide, well, it wasn't essential, prior to Obamacare, so we don't think it's essential going in the future. I'm just saying that could possibly be one way that they can reconcile coverage but reducing costs. And there may be other things.
Isn't one of the problems from their perspective been that while Obamacare or the Affordable Care Act was originally passed as a way to control healthcare costs, we have seen a fairly significant expansion of healthcare costs in general. Isn't that the case?
That is the case because there was so much pent-up need, and we've not had yet the opportunity to reach a tipping point. Because it takes a while to get people from chronic conditions, unattended chronic conditions, to stabilize them and for them to start getting better. So unfortunately, we've not seen the reality of when to reach that tipping point and see the reality in terms of cost reductions. There has been cost reduction in other areas as part of the accountable care because prior to the Medicaid expansion, the Centers for Medicare and Medicaid had made changes in trying to get quality improvements in the Medicare program. So there's other savings that have been achieved. The health centers have proven over the years, and certainly in the last 3 years, that cost for a Medicaid patient at a health center is 22% lower than in the private sector.
Thank you, Irma. I really appreciate it. I hope we all get well here in the next few months. Thanks for being on the show with us.
I wish we had more time. This is a very important topic, very important to the public and the community as a whole.
Well.